Welcome to Chronic Pain Chronicles with Dr. Karmy, where we navigate the intricate landscape of chronic pain management and explore the cutting-edge treatments that can make a difference in your life. I'm Ravina, your host, here to guide you through today's discussion. In this episode, Dr. Karmy will be shedding light on Botox therapeutic injections, a treatment that has been gaining recognition for its effectiveness in managing chronic migraines. With migraines affecting millions of people worldwide and often resistant to conventional medications, finding a viable alternative is crucial. Dr. Karmy will explain how Botox therapeutic injections work, discuss its pros and cons, and help you determine if this treatment might be the right option for you. As always, we are fortunate to have Dr. Karmy, a seasoned expert in chronic pain management with over 20 years of medical experience, to share his invaluable knowledge with us.
Hello, this is Dr. Karmy, and today I am going to talk about Botox therapeutic injections for managing chronic migraines. Are you someone who has frequent and severe headaches and has tried multiple different medications for headaches, but unfortunately none of them work? Or maybe they do work, but only partly, and your headache is every day, but you're only allowed to take your medications 3 or 4 times per month. So then maybe you proceed to try nerve blocks at the pain clinic, but they only work for a day or two. So what are some of the other options? One injection-based option is Botox therapeutic injections. Botox therapeutic injections are identical to cosmetic Botox that movie stars and housewives will use to try to reduce or prevent wrinkles. The only difference is that it is injected in different areas, plus the dose is generally higher. Botox, incidentally, is identical to botulinum toxin that causes botulism. The difference is essentially the dose. Like most things in very high doses, it can be a poison, but in low doses, it is a medication. The dose that's administered for therapeutic purposes, from what I understand, is about 1/100th of the dose that causes botulism. The reason people die from botulism is because the botulinum toxin paralyzes diaphragm muscles and people stop breathing, which essentially says that it is a very powerful muscle relaxant. And if you get the dose right or reduce it significantly, then it can be very effective at relaxing muscles. The mechanism of action of botulinum toxin is that it blocks the release of acetylcholine from motor neurons, which are the nerve cells that are responsible for controlling muscle movements. If you listen to my interview with Dr. Henry, you will know that neurotransmitters are a way for nerves to communicate with each other, but also they're used to communicate with muscles. So if acetylcholine releases are blocked or reduced, that means that muscles are not in as much spasm. In addition to that, Botox can reduce the release of neuropeptides from sensory neurons. So Botox can reduce the release of CGRP, calcitonin gene-related peptide, as well as substance P. So what are the pros and cons of Botox injections? The positives are that it is a relatively low-risk procedure, and when patients do respond, because not everyone does, I would guess the response rate is somewhere between 60 and 70%, and the duration of response varies from 2 to 6 months. When the patients do respond, because the benefit lasts for several months, you don't have to come back for injections weekly as you do with nerve blocks. It also has a relatively low complication rate. I would say that it is actually one of the safer treatments for pain that I have seen. Plus, it also has a cosmetic benefit. In other words, because some of the spots overlap with spots used for the treatment of wrinkles, patients will end up with smoother foreheads. From a cosmetic perspective, it will raise your eyebrows, it will paralyze the forehead muscles. So if you like to communicate with your face and are very expressive with your face, you may not enjoy the cosmetic effect. Also, there's no limit to how long you can continue doing the treatments. So typically, patients will get their Botox injections every 3 months or so. If it helps them for 6 months, they don't need to come back. The only limitation is you can't offer Botox more frequently than every 3 months, because if you offer it too often, you may develop antibodies to Botox, which essentially means that it will stop working for you. The rare times that I have seen side effects with Botox, it was things like fever and rashes. Also, it's not recommended to give to pregnant women. And there are some other contraindications in patients with certain neurological disorders. Now, in terms of cons, the biggest one is cost. It is a very expensive treatment. A single vial of Botox in Ontario costs $450. I'm talking about one 100-unit vial. In a perfect world, if you are treating a patient experiencing frequent headaches, you will need 2 of those vials. So that doubles the cost of Botox to $900. Then on top of that, there's an injection fee. Typically, the injection fee is not covered by OHIP, which will range anywhere from around $200 to $300 per treatment. So adding it all together, each time you do Botox, it'll cost you $1,000. Now, if you have a drug plan, then the cost may be not as prohibitive. Most drug plans would have required you to have tried and failed many medication tablets that prevent migraines before trying Botox. Also, you have to suffer from chronic migraines, which I define as having headaches at least 15 days per month for at least 3 months. Unless you have that frequency of headaches, typically insurance companies will not cover Botox for you. ODSP will cover Botox sometimes as well, but one needs to have a physician complete a special application. And just like other insurance plans, you would have had to have failed several preventative medications. However, if you jump through all these hoops, Botox itself is the biggest part of the cost that will be covered. Of course, that still leaves the injection fee. So what are the other cons? Botox is a very powerful muscle relaxant. If one injects it incorrectly or with too high a dose too close to the eyebrows, gravity pushes the Botox down into your eyelids. You may have to walk around with lower eyelids for a month or 2 until it wears off. Unlike nerve blocks, which leave your body within 24 hours, Botox sticks around for a long time. If you are injecting Botox not just in the head, but also into the neck, as a lot of patients with headaches will also have neck pain, you may weaken muscles of the neck responsible for keeping your head up. You might end up with a droopy chin or head for a month or 2, or sometimes even muscles responsible for swallowing. You may not be able to swallow for a few months. Again, this is avoidable if one starts with very low doses of Botox or if one avoids injecting the neck completely. Botox, incidentally, is not just used for headaches. It is used for several other applications. First of all, it is used for muscle pain throughout the body. So it is used for neck pain, shoulder pain, back pain, and knee pain. I have on occasion used it for radiculopathy with good results. Having said all of that as a very general statement, I would say that Botox is the most effective and helps the largest percentage of patients with headaches. And then when it comes to pain in other parts of the body, the duration of effect is shorter, often just a couple of months. and the magnitude of effect is smaller in terms of percent of pain reduction. Usually you try to avoid injecting Botox between the shoulder blades because that can impact one's posture, but there's also a long-term concern with Botox if patients are injecting it every 3 months. Forever and ever, could it perhaps cause muscle atrophy? I'm not talking about paralysis here, but perhaps makes muscles weaker. It has also been put to question whether or not radiofrequency ablation can also damage nerves to back muscles, which can also cause muscle atrophy. Aside from pain indications, Botox is also used for other neurological indications, and those patients or hip covers, not just the Botox, but also the injection fee as well. There's a condition called cervical dystonia where patients' muscles develop extreme spasms to the point that sometimes their head is almost touching the shoulder. There is spasticity, which is extreme spasms of muscles after a stroke or multiple sclerosis, where again the spasm is so severe that sometimes arms and legs become deformed. Cerebral palsy is another brain injury where you could have severe spasms that are beyond the level of everyday spasms, but spasticity to the point that it affects the ability to properly move your arms or legs and perhaps causes deformities. For these conditions, Botox has been a real game changer, and it is fully covered for those problems. There it is mostly used not so much to reduce pain, but more to reduce the deformity. Sometimes the injections are done with EMG guidance or ultrasound guidance because more things can go wrong. The doses used are typically much higher than the doses used for pain management. And one also has to make a decision about which of the multitude of muscles of the neck one needs to inject. So it's a much more complicated treatment than, say, treating migraine headaches, which are just the standard sets of spots. Another rare use for Botox is for bladder spasms. Urologists inject Botox into the bladders of patients with overactive bladder. Botox is used on occasion for erectile dysfunction and even hair regrowth. The effects perhaps are not particularly big compared to other alternatives. For some of us, more of a rare indication, but it seems like it can be useful in addition to the management. What are my parting thoughts on Botox injections for chronic pain management? I think overall it's a good treatment option for patients suffering from migraines. These patients often will not respond to some of the treatments that are used for back pain, such as radiofrequency ablation or platelet-rich plasma injections. So aside from nerve blocks, there are not too many interventional treatments for treating migraines that help. Botox is also worth a try for other painful areas such as necks, shoulders, backs, etc. However, typically it is not my first-line treatment. It's more for patients who have failed some of the other approaches. Thank you for listening. Till next time.
Thank you for listening to the 8th episode of Chronic Pain Chronicles with Dr. Karmy, where we explore chronic pain from a physician's point of view. In our upcoming episodes, we'll continue to delve into some of the most effective and widely used approaches to managing chronic pain, such as cortisone injections, radiofrequency ablation, and more. We'll also investigate the causes of chronic pain and where the field is heading in the future. Furthermore, Dr. Karmy will interview seasoned professionals and leading researchers in the field, sharing their insights and expertise in our discussions. I'm Ravina Ojala. Until next time, take care. Disclaimer: when it comes to your health, always consult with your own physician or healthcare provider for personalized advice and guidance. The information provided in this podcast is for educational and informational purposes only and should not be considered medical advice or a substitute for professional medical care.